All of us at some point in our life will experience chronic or life-threatening disease. But here's one thing we rarely experience: a doctor who encourages us to explore and embrace new medical approaches. Meet Dr. Robert Bart, a trailblazing medical innovator whose mission is transforming patient treatment and care. Dr. Bart follows the inspiring legacy of his father, a decorated U.S. military doctor whose out-of-the-box treatment helped him overcome polio at the age of 5. Dr. Bart travels the world to uncover, test, and implement cutting-edge diagnostic and non-invasive technologies, from early cancer detection to groundbreaking minimally invasive imaging and treatments to minimize the recurrence of cancer. Dr. Bart's powerful message to doctors is break the box and embrace innovation. Don't miss this rare insight into a caring, respected, and impactful doctor. Enjoy. Dr. Bart, thank you for giving me a little bit of your time. I know you're busy. Welcome to the Entrepreneur Next Door podcast. It is truly an honor to meet you. I'm excited for my guests, for my listeners and subscribers to get to know you. So I want to jump into it because you have an active practice and there are patients waiting for your magic, and we're going to try and keep it shorter than my typical podcast. So I have lots of notes. I'm going to look aside for a minute. I'm going to start a little bit differently than the way I typically do my interviews. In 1944, during World War II, in a military operation codenamed Flintlock, the U.S. Armed Forces set out to capture the Marshall Islands, which was a crucial place for the U.S. to advance closer within bombing range of Japan, or Tokyo. A young Jewish doctor, Captain Harry Schwarzbart, who volunteered to serve in the U.S. military, was awarded the military honor for his bravery and saving numerous lives during the fierce battle. While fighting for the U.S., Mrs. Schwarzbart gave birth to a son, Robert. You. 80 years later, among letters that your decorated father wrote from the war to you, you found an old newspaper clipping from a Yiddish newspaper where you learned about the recognition of your father's bravery. How did that impact you, finding something 80 years later, a newspaper clipping about your dad? And of course, you're continuing his legacy as a doctor, but what did that do to you?
Well, it's making you think back on how your life has been and where it's going and what it can do further. Because when I was finishing my radiology residency at Downstate Medical Center in Brooklyn, my father said, "Look, I've been working for many years. My wife and I want to take a trip to Australia. Can you cover the practice for me?" I'm a resident. I'm a trained doctor. I said, "No problem." So I took over his practice in Brooklyn. I went from the top of Brooklyn to Flatbush and covered his practice after my residency hours. During that 3-week period, I lost 15 pounds because I saw what a real doctor does. My father would see patients, and then if you had to do a house call, I would have to walk up 4 flights of steps in a Brooklyn apartment to see somebody who couldn't walk. So it was a humbling experience.
So I want to pause and then fast forward to some of your accolades, because it will take us probably 2 hours to go through everything you've done in your career. But I'm going to read quickly through this and then come back. You've been trained at the U.S. Armed Forces in pathology, 1973, tumor radiology, Manhattan Eye Hospital in ophthalmic ultrasound. Since the 70s, you made great strides in technology developed predominantly in European medical centers. You trained in Copenhagen in ultrasound-guided biopsies, in London in Doppler breast cancer sonography, in Paris for Doppler prostate cancer detection and biopsy, in Montreal for tendon sonography, in Toronto for prostate MRI imaging, in Rome for bladder diagnostics, in Paris for Doppler melanoma detection, and in Madrid for 3D skin cancer imaging. So you received your MD from Syracuse, but then you got a board certification in radiology after that. What made you do the switch from family medicine to radiology? Do you remember?
Well, that was easy. I was drafted. And even though I was a slightly disabled doctor, according to the military, if I could talk and see patients, I was fit for active duty. So I was drafted and I was sent to Vietnam. And because of that, I was able to see different parts of medicine. In other words, medicine in Asia is somewhat different, and the Asian bodies are different than American bodies. In other words, nobody's the same. If you think everybody's the same, then you can't do medicine the right way. But the genes in Asians are different. For example, they would squat down on the floor to eat. The Americans tried that, and of course, they would get knee arthritis after a couple of weeks and they couldn't work. So you have to realize that there are huge differences in the way people are and the way people need to be treated. More importantly, because I had the military experience as a major in the Air Force. So I was at an Air Force base just south of China. And because the war was active, we used to have drop ins by foreign generals. We were the only radiology center within 400 kilometers around northern Thailand. So we got to see injuries that you could never see, like pilots ejecting out of planes upside down. We saw trauma. And we also learned the esprit of being in the military. It's a brotherhood. There, people work together and they fight together. And we were honored to be part of the military civilization. Also, it did happen at that time because instead of going into the area of radiology where you inject contrast into people's veins, arteriography, that is to look at aneurysms in the brain and aortic aneurysms in the abdominal aorta or kidney cancers, I found the field of ultrasound existed. So I decided to look into that. And as I was studying it, I realized this is non-invasive, it's quick, it's you can do it by yourself. You don't need a whole team to do it. And I asked the professor of who was in charge of our radiology program, and he said, "Don't waste your time doing this." So I said, "That's interesting," because I saw the future in it, and I've been told no throughout my life. So I said, "You know something? I have a leave to go during the end of my residency." So I went to Washington, D.C. to learn radiology at the Air Force's Institute of Bone Pathology. And I saw things you could never believe because it came from the armed forces all over the world. So I got experience nobody else had had. Nobody from my medical center had gone there before. And then, since I saw this area wasn't working for me, asking the local people, in other words, using the local point of view, what to do, I called up the professor who was the head of ultrasound at Harvard Medical School, who was the only other person doing ultrasound in the country at that time. And he said, "Well, you can go to Japan or go to Europe." So I went to Denmark. I was single. I figured a nice time. And I did things in Denmark that were unbelievable. First of all, they were smart. Secondly, they were easy to do. Thirdly, they were the right thing to do. And fourthly, you couldn't do it in America and still cannot do it in America. Simple things. I was biopsying the pancreas. Pancreatic cancer is a big deal. And radiology, we used to see the pancreas by drinking barium and seeing the abnormalities. Well, today you can see pancreatic cancer in 2 minutes with a CT scan or a good ultrasound scan. But what I was doing was using ultrasound to see the pancreas, stick a needle into the patient who is awake. You don't have to cut them open to get to the pancreas. And you put the needle in, take a few biopsies, and if it's benign, good. And if it's not, then the patient then needs to be taken for definitive therapy. So yeah, these things changed my life. I realized you have to move forward with your own ideas, like my father did. During World War II, he left his practice and signed up to protect America.
I want to read a couple more quotes about you or from you. My patient's needs drove me to seek out the latest in medical imaging and biogenetic to provide everyone with the best the medical community has to offer. I'm committed to the mission of providing painless, outpatient, quality of life preserving options for the diagnosis of cancer within the sole directive of supporting minimally invasive treatments using image guidance to focus on tumor destruction while sparing healthy tissue. Our goal is to improve patient care by providing world class imaging services not widely available in the US. So, the question that jumped at me when I was studying you is why are we not providing world class medical care? And it takes a pioneer like you to push it to the forefront, but it's still not in the forefront. Is it that traditional medicine is so much against it?
This is a complex question and dealing with several groups of people who are involved. You're dealing with doctors who know what they know. They also don't know what they don't know. And unfortunately, today, because of the way medicine is run, people are interested in just protecting themselves. And frankly, the enthusiasm that I used to see in young doctors is not there anymore. You needed something to spur you on. And that's what I saw for myself. I was in Florida 2000, and my wife said, look, they're doing something new in prostate cancer, because I do prostate cancer imaging with ultrasound. I've been doing it for many years before that. And she said, they're putting a needle into the prostate and using a laser and killing the prostate cancer in minutes without surgery. And guess what? They're using ultrasound guidance to do it. So at that time, MRI was developed, and now we're using MRI in the prostate and ultrasound guidance to find and kill tumors non-invasively. You can do it with focused ultrasound, like energy ultrasound that destroys, or heat, or freezing, or most likely we're doing lasers today. You stick the needle in and boom, you zap the tumor. And the beauty of this minimally invasive treatment is you can monitor it. What we learned very quickly was tumor physiology. The tumor needs blood. So with ultrasound, if a tumor has 5 vessels to it, bad. If it has 1 vessel in it, probably less aggressive. So this way we found a way to not only to find tumor by the blood vessels pointing to it, more blood vessels, more tumor, but you can see how aggressive a cancer or an inflammation is. The same thing for rheumatoid arthritis. So last night with the Arthritis Foundation, I'm a board member, we were talking about treating rheumatoid arthritis. And the problem with treatment is there are side effects. So if there's a way to see if the treatment is working or not working, this is very good. So if you use the blood flow going from this down to this, treatment's working. If it goes from this down to that, change treatments. It's really very simple. The medical community, unfortunately, is really stuck in insurance problems because the insurance companies don't pay for many things more and more. And people from other countries who used to go to the Mayo Clinic and used to go to Texas for treatment, now they're going to Europe or even Thailand for advanced treatments because the system is open to new things, and the United States is really slowly falling behind. We need more input by our leaders to push things forward. This is possible, it's doable, it's better. And I think if America will move forward and do something, when I trained in France, if people didn't like things, they ensured the grève. In other words, they would strike. There would be people filling the streets and nobody would work for a day. And guess what? The government listened. And my wife says, how come people aren't rioting and protesting in the United States? Why nobody's striking? She couldn't understand this because we've become soft. And when you become soft, lose enthusiasm, you also lose momentum, and then you lose your country. I don't like the way things are going. And I think if we can all get behind doing something better, In other words, let's try to treat cancer before it needs to be treated. Let's find it earlier. We're working with genomics now and genetics. I really never wanted to get involved in that, but now I realize this is so simple. You can have some blood tests that tell you not only if the tumor is aggressive, but what treatment will work and what treatment will hurt you. So this is all available now. We have to be open to doing it. And more doctors are leaving the traditional medical system and going into functional medicine, which uses genomics and the advanced imaging that we're doing. So all this can be changed because medicine changed my life. I'm the prime example of how medicine can be better if you're open to new ideas. Let's go back to 1945. My father was a war doctor. He treated war wounds. And in 1949, I was told, you're going to die, because I was in the hospital from infantile paralysis polio, which was paralyzing me. I was in the hospital for a year and I couldn't walk. And at some point, because when you lay flat, like when you break your hip in old people, you get pneumonia. I got pneumonia. The doctors who were treating me at this special center said, they called up my parents and said, not only will he not be able to walk, but he may die. We're going to put him in the iron lungs so he can breathe. My father told my mother, honey, we're going to take a day off and go to the country and see Robert. He saw me. He told the doctors, I have an infection. Give me penicillin. Now, penicillin in 1949 was unheard of in the United States. It was used throughout the war because if you gave a patient antibiotics, you wouldn't have to cut off their foot, which is what my father did. In other words, he was using advanced treatments that were okay for the military around the world, but were not okay in America because this was the way people thought. We're in a box. You have to break through the box to get things. So my father said, see these little blue pills? Put them under your pillow, and every night take one. A week later, he came to see me, and I was better. And the doctors knew nothing. They had their way. It's infection, iron lung, you die. Just like we, through the pandemic we went through. You put people on ventilators, and they, most of them died. But because we didn't listen to what other countries were doing, like Sweden, they said, okay, if you have COVID, it's like the flu, only bad. So some people will die, some people won't.
So I want to go back to a couple things, again, in interest of keeping you as long as I can. We're all familiar with 9/11 and the impact that it had on particularly the firefighters and the first responders in terms of the toxicity. But I found something in your background that I didn't know about, and I'm sure most people don't know about. In 1975, something happened. It was called the New York Telephone Exchange Fire, where 699 firefighters died from toxic exposure to 250,000 pounds of burning PVC, which later caused cancer. You are the chief medical advisor for the firefighters against cancer and exposure. You're also incredibly passionate about veterans who are suffering as well. Talk a little bit about that, because that's one of your life's missions, right? It's medicine, but it's also treating people that are sacrificing, but unbeknownst to them are also being exposed to terminal diseases.
Yeah, toxic exposure is very important, which we learned from the firefighters because it introduced us to toxins on the skin, toxins you eat, toxins and cancer and toxins in the environment. For example, this is from Columbia magazine, that weather and climate change. So climate change produces fires and climate change produces toxins in the environment. And these are areas that we are learning from because when toxins get on the skin, it produces skin cancer. Matter of fact, from 9/11 and the fire exchange, the top three cancers were skin cancers, with melanoma being the most aggressive and most deadly. Surprisingly, lung cancer was the fourth most common, but the fifth most common was prostate cancer. And I see all the guys from the 11, they come in once a year and we say, guess what? Your prostate cancer that I can feel and that I showed you, which has this many blood vessels, hasn't changed. So we learned over the years that cancers with this many blood vessels can remain stable or the body can fight it off. And this is where genomics and genetics comes in. It tells you how likely your body is to survive or overcome a low-grade cancer. Remember, we're always making cancer and we're always fighting it off. So we learn to boost the immune system at that time. So we would bring these technologies back to the firefighters who used to come to their wives with a dirty smelling, smoky uniform, and now they will wash themselves up and get the cancers out of their body. They prevent cancers. It's simple. You remove toxins in your environment, you decrease your cancer rate. And because of the ultrasound, we are able to see toxins in the skin because our resolution is so high, we're seeing virtually microscopic areas now in the skin that show toxic particles in the skin. So you can alert somebody, hey, get your water checked. We had a woman come in and we were scanning her face for some skin problem. And I said, you have these little white dots in there. They look like shiny stars or scintillating stars. She said, my mercury is high. Could that be related? And this was years ago. And I thought, hmm. So I studied, and apparently the cancer particles and the radioactive particles can show up in the skin as tiny little areas. So I said, bring in your daughter. And she brought in her 18-year-old daughter. And guess what? Instead of having a whole bunch of white sparkling things, the daughter had a few sparkling things. So at least we were able to tell her, you've got a risk that is previously not only not understood, but undetected. And now you can do something. You can change your environment, change your diet. Or most people come in from Connecticut, it's toxins in the ground. In Long Island, it's the pollution that's from the labs. In other areas like Pennsylvania, it's radioactivity in the water, believe it or not, or coming from the fumes underneath, the radioactivity gases that are around, or most likely from the environment, which is a lot more toxic because we're allowing toxics to come into the way we produce food.
So, Dr. Bad, it's very often the question I ask my guests is when you look back at your journey, in your case, incredible accomplishments over many, many years in medicine, can you point to one thing that perhaps defined who you are today?
Yeah, the fact that I was willing to break out of the box, just like my father broke out of the box and left his practice and went to war for us, and the fact that I was supposed to die and I didn't because people brought back new technologies from Europe. I realized that if you're stuck in what you know, then because you don't know what you don't know, and in medicine there's so much going on throughout the world that's available, you have to look and see what else is available and then what else is doable. Then you also have to learn to fight the system. I was told don't go into ultrasound, which is now the most widely used technology globally. Ultrasound probes are everywhere. They even make them as small as a cell phone now. And the entire state of Florida, for example, has put it in their fire department and their ambulance services. So you can scan patients before they arrive at the emergency room. So this is something that is available. And if all the states would adopt what's going on in Florida, they would you'd have better emergency care, for example.
Yeah,
So
so I think it's incredible, Dr. Bard, that someone who received his medical degree in 1968 and radiology in 1974, so people can do the math. But it's so refreshing to talk to someone with that lifelong knowledge that is a proponent of, as you said, breaking the box, of innovation, of disruption that ultimately delivers the reason why you became a doctor anyway is to improve lives and improve patient care and patient outcomes, right? And you're not afraid to test and explore innovative technologies that deliver on the oath you took many, many years ago, right?
Yeah, this is important because 10 years ago, I was at a radiology conference in Orlando, and somebody was holding something that looked like a yellow football. And it turned out to be a portable ultrasound machine that you could put like only somewhat bigger than the cell phone. So I decided to go to Canada, and I saw they had this portable machine that you could put in your pocket and send images anywhere in the world. This was Canadian. So I worked with a Canadian company, and I realized I just came back from Canada with this diabetes and optical imaging. Everything's changing. We're using waves, radio waves, um, using near infrared vision like radar and sonar and light waves that go through the body and come back. So this is all available, it's all possible, and it's being done. If we look out there and see what else is being done, you can you can advance medicine and save lives, frankly, with new technology. This is you know this and the Canadian doctors are coming here to work with me to set up something in America because they're doing it at McGill, where I just came back from, because they've got something interesting you look and see, and you work together, and it's exciting. Not only do you do the right thing, but it's professionally exhilarating because you can see you can make progress, you can make change, and do it the right way.
So, Dr. Bod, I had Russ Allen on my show last week. His podcast will be released today, and he obviously admires you, but he's another one of proponents of his Wellness Now centers, of bringing people in for treatment in with non-invasive advanced technologies that do make a difference. And in 2022, I believe you received the Ellis Island Medical of Honor for your work in cancer imaging and clinical research. I know you're not doing this for accolades and medals. It's clearly comes across your commitment to the basic function of medicine, which is to improve lives, and especially in a pill taking, surgery happy society, which is expensive. I think your work, it's not just pioneering, it's disruptive from an innovation and life changing aspect. And I want to change gears to something completely different. I know you're a big supporter of Israel, where I am from, proudly. Without getting into the politics of war, because I believe it's the politics of war that's preventing peace. And especially with your father's legacy as an immigrant to the country when Jews escaped Europe. I believe he wasn't able to even to be accepted to the US, so he'd volunteered to be a soldier, which was his way of, I'm not going to call it getting the green card, but that was his ticket in, right? Okay, I'll go serve in the army, and he did. Why does Israel mean so much to you?
The pioneering work being done by the Israelis is also humbling because they've been developing advanced technologies. They've been working with advanced medicine for a long time. One of my cousins, Simon Gon in Haifa, had the biggest radiology practice in the that part of the world. In other words, people from Egypt, Morocco, and African countries would come to Haifa because he had a huge radiology center. I was there when I was a kid, and he had 9 X-ray machines. Most doctors have 2 X-ray machines. He had a huge center set up, and he was delivering world-class care. He was sort of the Mayo Clinic of the Middle East.
Mhm.
So I saw that this is possible, and the Israelis have been surprising us with really insights because they push. They look for what's better, like I do, and I support the open society that they have in exploration. I think it's really good that the people want to do more and are doing more and are finding new ways of life, like kibbutz is fine. It's foreign to Americans, but it works for some people. So why not try what's possible and it works? So they're adventurous.
So I want to end by asking you, maybe it's a complex question, but it's simple. What's your message, not to your colleagues in the medical community, but for people like me who are patients? What's your message to patients who suffer from a variety of illnesses, chronic or otherwise? Some detected, some undetected because people don't use the technology that you use. All of us are suffering from something, right? What can we learn from
Okay.
Dr. Bart?
My message, because this has affected me personally, my message is be open to new ideas. Well, a lot of stuff on the internet is garbage. Uh, a lot can be useful. For example, Russ Allen, I have to thank him because he pointed me to a new healing technology. And one of the reasons I went to Canada was to try something new on myself. And from my polio, I have muscle pain and muscle weakness, and I've been getting physical therapy for a muscle problem in my right knee for 6 years, and it hasn't helped. I tried this new technology up in Canada. It was actually in the Jewish section of Montreal, the Orthodox section, and I was afraid because I didn't know these people. I was trying it blindly, and they spent half an hour just examining me, another half an hour positioning me, and then in a 3-minute treatment that they did on the brain stem, the pain in my knee was reduced 90% after one treatment, after 6 years failing or not getting better from the routine physical therapy. So this is amazing. I'm trying to bring this technology back. So go to the internet, see what's available, get a good article and show it to your doctor, because most likely they don't have the time or the interest to listen. It's mostly time. Doctors are they're forced into a work paradigm now, and also run by the insurance companies. We're controlled. So see what's available. Go outside. There are other treatments available if you look for it. For example, we're working with the soldiers, and actually, I want to do this with the Israeli soldiers. We're using things for PTSD, pulse electromagnetic therapy, which is again used worldwide. Again, it was used in Canada for treating the PTSD in uh, the Canadian people who came back from traumatic experiences. We have it in our office, and I think these things are minimally or non-invasive. They can't hurt and they can help. And the medical profession has to realize that if you can treat the knee and rebuild the knee with 4 months of this pulse electromagnetic instead of knee surgery to replace the cartilage, this is all available. So ask your doctor and then go for other opinions, even to functional medicine doctors, and see what else there's possible. So basically, don't quit on yourself. If you're in pain and nothing's working, there are other ways. Just look for it, like I did. Like I went to Canada to look at something, learn a new technology, and bring it back here. But also, I learned there are better treatments because it worked on me. I'm proof positive of things working and being minimally or non-invasive.
Yeah, and so I think your message of breaking the box on the medicine side is obvious. Don't contain your ability to impact patients by following the trends, but explore innovation and new technology. But on the patient side, what you just said was don't accept the norms as they are. Educate yourself, whether it's Googling, whether it's talking to people, whether it's studying people like you. And if somebody went to your website, and I will include that in my show notes, they can start exploring what technologies are available today that are non-invasive, that do work. It's not voodoo, it does work, and quite often, but the problem with Dr. Bhat is that when you introduce something to somebody, the first question they ask is does insurance cover it, right? Because that's a healthcare model. It's not socialized medicine like in Canada and the rest of the world. It's a legitimate question, but there are some modalities and some treatments that are not going to get you bankrupt that are way better than surgery and post-surgical infections and surgery is surgery, right? You don't know the outcome. You can expect it to be okay, but yeah, break the box. Don't just the first question shouldn't be does insurance pay for it? The first question should be does it work? Is it going to improve my quality of life in a way that's way better than going under the knife, right?
Yeah, is it worth it? That's the real question. It's not paid by insurance, so you spend some extra money and have 6 years of better life, like I did with my knee problem.
Yeah. Interestingly, and I'll end with that. And again, thank you for staying so long with me. 3 years ago, I had a surprise bypass for somebody who's very active, no cholesterol issues, nothing. I had the widowmaker artery that was 98% blocked. Luckily, I was able to get a what's called the cabbage, a CABG, a robotic bypass instead of, as you said before, I wasn't filleted and ripped apart. It was a robotic, the Da Vinci robot that interesting I worked on 20 years ago when I was in the medical device industry. But the point of my story is that as I educated myself post bypass on what led to my condition, and I read a book called The Heart Attack Gene. I never had a heart attack, but it describes all the non-traditional ways that people can do for themselves. And there's a simple test called the CAC test, right? I'm sure you know about where a simple scan that measures the age of your artery that insurance doesn't pay for. It's $100, but it is the quickest, non-invasive way to tell you you got some problems before they become a heart attack or a bypass. So to your point, get educated. $100, insurance doesn't pay for it, but it's life changing. I never knew about it, but I preach it to everybody I know.
Also, look at the value in preventing a disease where you can't work anymore. That's what I try to tell the people who make the insurance policies, that for a simple test that you're not covering, you can save money by not having to pay for years of chemotherapy or radiation. But it doesn't seem to penetrate the mind of the insurance companies that you save money by doing a better job by trying things that are undiscovered or not validated. But they don't want to do it. They're in their own box. So as long as nobody protests, it'll be the same.
So in 1945, when your dad was fighting in the Marshall Islands, and that Christmas he was able to listen to you for the first time when you were 2 months old over the phone. We fast forward, we're 2024, you're going strong, you're making a difference. Dad's looking down and is proud. And I want to thank you for the work that you do in breaking the box and impacting lives. And it's truly, truly an honor to have somebody like you on my show. So thank you again, Dr. Bott, for your time.
Thank you.
It's been a pleasure.